Good afternoon, everyone. I welcome all to the third international conference on mind-body medicine in endocrinology and diabetes. I request Deshmukh, President here, to take on.
Thank you. Good afternoon, ladies and gentlemen. It's indeed a pleasure to begin the virtual session for Synapse 2022. Dr. Deshmukh has been held up, so I will be taking over and starting the session. It looks a very interesting session. Lots of things related to mind health are going to be discussed here. Without wasting much time, may I now invite the moderator for the uh, session, Dr. Ameya Joshi. May I see Dr. Dr. Ameya Joshi, I hope you're already logged in. Dr. Ameya, am I audible? And yeah,
Yes,
I can see you. Great. Welcome.
The session, sir. So after that,
Yes.
we all are available. Yes.
Yes, okay. So to introduce Dr. Ameya Joshi, he is and endocrine clinics Mumbai and consultant in charge of endocrinology at Bhaktivedanta Hospital and Research Institute and Karuna Hospital Mumbai. He is a recipient of the IDF and European Society of Endocrinology Young Scholar Grant. He is an executive member of ISBMR, which is the Indian Society of Bone Mineral Research. He has been actively participating and helping us.
Hello, everyone. Very good afternoon. At the outset, I thank Dr. Vaishali Madam on behalf of all of us. Every year, she has been organizing this wonderful event connecting the minds of caregivers, paramedics, patients, and key opinion leaders in this wonderful event called as Synapse. This happens to be the third international conference, and I still remember the first one, which was held physically. We had to give it up to COVID in 2021 and had a virtual fantastic event. This year we are back, hybrid, all learning new skills. And in this interesting panel discussion, we will be discussing about 360 degrees perspective to the health of endocrine patients. Myself, Dr. Ameya Joshi, am Director of Diabetes and Endocrine Clinics, Mumbai, and Consultant in Charge Endocrinology at Bhaktivedanta Hospital and Research Institute and Karuna Hospital, Mumbai. I am also pleased to introduce my co-panelists, Dr. Deep Datta, or Professor Dr. Deep Datta, who is an endocrinologist at Cedar Super Specialty Healthcare. He has formerly been Associate Professor of Endocrinology and member of Ethics Committee at Dr. RML Hospital, Delhi, with 230 publications in indexed international journals to his credit. He has been a florid researcher and a member of RSSBI, Endocrine Society of India, ISBMR, ISPA India. He currently serves on the Executive Committee of Endocrine Society of India and ISBMR. We welcome Dr. Deep. Our next panelist is Dr. Sandeep Ruder. Dr. Ruder is a clinical endocrinologist at Life Fourways Hospital, Johannesburg, South Africa. He's an honorary consultant at Charlotte Maxek Johannesburg Academic Hospital and associate lecturer at University of Witwatersrand in the field of internal medicine and endocrinology. To his credit is that he is also a student of philosophy at Vedanta Academy India, and currently he is joining us from Vedanta Academy. He is a public health advocate with a benchmark clinical advocacy for taxing the sugary drinks in South Africa. He has been an author and co-author in local and international journals on the topics of diabetes and philosophy in medicine. And I must say, he's a very powerful speaker with very clear thought process. Our third panelist is Dr. Arundhati Dasgupta, who is Director and Consultant Endocrinologist at Rudraksha Super Specialty Care, Siliguri, West Bengal, the first endocrinologist to start endocrinology in that particular part of West Bengal. She has received A.V. Gandhi Award for Best Thesis and Diabetes Award Initiative in 2018. Has done more than 130 awareness programs in endocrine disorders across northeastern states, and is a course coordinator for PHF and several other national and international training programs. She has presentations at multiple platforms and several publications, as well as contributed as an author to several chapters in many books. Dr. Arundhati is very popular amongst patients and a very good speaker. Next panelist of ours is Dr. Archana Juneja Madam. Madam is a consultant endocrinologist at Kokilaben Dhirubhai Ambani Hospital, Mumbai. She is a PG guide for DNB endocrinology and has special interest in neuro and reproductive endocrinology, thyroid and type 1 diabetes. Has more than 10 publications in indexed national journals and is a guest reviewer of this British Journal of Neurosurgery. Madam is an invited guest faculty at regional and national diabetes and endocrine conferences, API, anesthesia, ENT, and gynecology CNEs, and has been honored with A.V. Gandhi National Award for Excellence in Endocrinology and R.M. Patel Award for Best Paper in Nair Hospital. A very organized endocrinologist, more than that, a fitness enthusiast, as well as somebody who is very, very professional in her approach in all fields. Our fifth panelist is Professor Dr. Deepak Jumani. Whenever Sir speaks, people follow and enter that hall. He is a wonderful, popular speaker whose peculiarity is that probably nobody has ever slept in his talks. He is a senior sexual health physician and counselor, diplomat, American board certified clinical psychologist, fellow of American College of Sexology. He is attached to JJ Group of Hospitals and Grand Medical College. He is course director and mentor, fellowship in clinical sexology, editor, International Journal of Psychology and Counseling, co-chairman, IMA Initiative for Sexual Health, Cybercrime Intervention Officer, Government of India, and author of bestseller, Sex Has No Expiry Date. It's a pleasure to have all of you on this wonderful panel in this wonderful event, Synapse. Let us start, and to begin with, I would like to ask Dr. Deep, who is beyond an avid researcher, also an advocate of yoga, and he has done original work as well as analytical work for the field of yoga and chronic diseases. So Dr. Deep, what is your view on yoga and mind health? What is the relevance, evidence, recommendations, and consensus? Recently, there was a statement from American Academy of Cardiology recommending or advocating meditation in cardiovascular diseases. Also, do these things have limitations, or when is it where you should accept that probably you need to consider yoga as an adjunct but not the only part of the treatment? Dr. Deep, your opinions, please.
Thank you, Dr. Amay, for asking such a wonderful question. It's a very relevant question regarding the role of yoga in mind health and what is its relevance in the 21st century. First of all, I would like to thank Dr. Vaishali Madam for making me a part of this huge conference, a very relevant conference on mind and body medicine. Our group, we did a meta-analysis where we showed that in people living with non-communicable disease like type 2 diabetes, if you are regularly practicing yoga, it really does make a difference in terms of lowering not only your fasting and 2 hours postprandial blood glucose, it translates into a better HbA1c lowering, and there are a lot of other pleiotropic benefits also in terms of beneficial impacts on lipid profile, that is reduction in levels of bad cholesterol like LDL cholesterol and triglycerides. So yes, yoga forms an adjunctive part of modern medicine. It makes the whole quality of life better in people living with non-communicable diseases. It reduces the endogenous sympathetic tone. The stress levels just comes down, and overall in the entire basket, the need for medication, the total pill count, the amount of medication, the quantum of medications does come down. So the, yoga and mind health is very much relevant in 21st century, and increasingly different societies are recognizing the role of yoga. So the key thing, what needs to be done, such an important forum provides a great platform, is that we need to standardize the practices. There are a lot of different forms of yogic exercises, breathing exercises, physical exercises. We need to do better quality, better control, and long duration clinical trials, randomized trials would be great to specifically find out which of the yogic exercises they have the better impact in which of the different endocrine disorders. Like there are some data to show that in people living with thyroid disorders also, yoga has a beneficial impact on hypothyroidism. So we know it works. These are something which has stood the test of the time. As per the needs of 21st century, we need to modulate it. We need to improve better quality English language literature so that it can be easily replicated, not only across the country, but across the globe.
Yeah, thank you, Dr. Deep. Very well said. Now, I would like to move on from yoga to spirituality. And nowadays, at least the section of people count on spirituality as an option. For some, it is a compulsion. For some, it is an obsession also. And when you look at the wellness wheel or how well someone is, spirituality is an integral part of life. So Dr. Sandeep, we want to know that spirituality for many is an optional thing in life. But does the presence or absence of it affect the wellness of an individual? And what is the need of spirituality in the wellness field?
Thank you, Dr. Maya, and thanks for having us on this panel, esteemed panel. I think it's a very important question, but I want to turn the question upside down a bit. I think there's been a tragic misconception that's led to chaos in the field of spirituality, because today's spirituality is considered to be rituals, religions, the attire you wear, living a simple life in a cave somewhere, which it is not. The definition of spirituality is the consideration of something more to life than just the material world, something transcendental. And in many of the sciences that are religious or spiritual in nature, they tell you that you are not what you think you are, and that your original nature is fullness and wellness and infinite peace and bliss. So when you think of that absolute definition, then the purpose of life, spirituality, becomes essential, not an option. The thing is, in today's material world, with our stress and acquisition and enjoyment and working hard and trying to pay off debt, people are stuck to the terrestrial world. There's no time to think of the transcendental concept of the nature of life. And that's the human prerogative. As human beings, we have that choice. The dilemma of choice is to consider the transcendental nature of life. So either you will choose to do it by choice and incorporate it into life as the ultimate pursuit, or we learn by challenge and people will turn inward. The problem is when you turn by challenge to the rituals, even the rituals get hijacked by the material nature of life, by the ego. So then we want to exercise for a short-term goal. We want to exercise to be productive. Whereas you look at the ancient sciences on this, exercising was to maintain the body so you could pursue higher goals. The breathing exercises were to help calm the mind. The intellectual exercises, Dr. Deepak just spoke about yoga. Yoga is derived from the Sanskrit word yuj, which means union with. Religion in Latin means means again, and legion comes from ligand or ligare, means to join. So religion means to join again. So with what? If it means again, it means we've fallen from some wholeness or wellness. And the very word health comes from the word whole, ultimately. That's the etymology of the word. So spirituality, whether by choice or by chance, will become an essential part of human life through our trials and tribulations, or ultimately getting there. And the various definitions of it at the end of the day, which is not the rituals and the dressing up. It's actually getting rid of ego through a calculated process of serving the world, of becoming more unselfish. It's identification with something more in life, either if you're starting at a basic level, family, community, nation, the earth, all human beings, all species, and then ultimately identifying what that transcendental concept, which are called different names, God, Bhagwan, Allah, all of these words have been given. But, that pursuit is a human prerogative. Even the atheist can say, I consider this concept of something more, but I reject it because my logical mind can't understand it. But and that is spirituality in a way. And ultimately, we'll want to come there because we'll find that the approach to just the material life always falls short. You get neutralized to all the toys and joys of the world. You get neutralized to all the name, fame, money, power, family, ego. Everything gets neutralized ultimately. So we will turn inward, and that inner journey is spirituality. The prescription for spirituality, though, has to be individualized according to the mental texture of the patient we're seeing. And that's where I think doctors can be of service. We provide a physical service, we provide an emotional service, we provide an intellectual service by giving scientific fact to patients and measuring, giving miracles to treat the physical body. But the ultimate service, and I've written it down here, would be spiritual service, where we create or maintain a suspicion and investigation of something more to life, something transcendental. And that inspires people, just prescribing pills and supplements is for the body. And we are all familiar with this concept called the kosher wheel. The outer kosher is just food, it's material. I joke with my medical students that the physical body is made of water and soil. And then you've got the subtle component, which is the breathing apparatus, the autonomic nervous system, everything happening, and we're blissfully unaware. Body temperature regulation, blood pressure, which if the mind is agitated, becomes dysregulated, is it not? So the actual work to do is actually manage the mind through the deeper structure, which is the intellectual sheath, which needs development. And this is what a lot of these sciences of the ancient times, these philosophies invite us to do. So we manage the physical body with exercise, diet, and we have esteemed speakers speaking on that. But ultimately, it's to keep the body stable so the intellect can be developed to manage the mind and then direct the mind to that higher transcendental space, which is spirituality ultimately. And I think it's a key component missing from modern medicine, which has become perhaps very materialistic, westernized, which is great with the science and evidence-based medicine. The technology is fantastic, more than we've ever had, but it's missing the heart element, the soft element of a deeper philosophy, I think.
Yeah, I think, Dr. Sandeep, it's always a pleasure to listen to you. And maybe you always understand something more about yourself, as well as maybe the way why you are and why you exist. I think you put it very, very well. And maybe it's a very concrete thing that we end up saying too loosely, or people end up saying loosely that they are spiritual or they are not, without even understanding the meaning of what it actually means or understanding what it pertains to. Thank you for that wonderful deliberation. I must say that we all are destined to be born and destined to die. And in between, the B of birth and D of death is a C of connect, the connect to this world. The connect that we establish with our family, with our peers, but also with our patients, with our staff, and what I can say, the medical social connect that we have. And with this comes the mind of the doctor, the staff, as well as the patients at that specific point of time. And we have to see to it as a leader of that ecosystem that it is healthy. So what is the need of social connect for mental health? And how does social connect help you influence coping? A question I would like to ask Dr. Arundhati, because not only is she a very good motivator, her programs, and I must say even her TV interviews are watched by many, but also she caters to so diverse a population group and still is always cheerful?
Thank you so much, Dr. Amir. And I really love this question that you've assigned to me, because, as we were discussing just prior to the starting of this panel, that we are always talking about medical things, we're talking about studies, we're talking about scientific material. That's great. But a lot of times we forget to talk about something which is so very important. And this is just how you placed it, the connect. All in all, I mean, when you're talking about social connect, it is basically about the connection that you develop with people around, and that could be your family, your friends, and as you said, your peers, your co-workers, your neighbors, anybody with whom you have an association. And in today's world, we do know that our society has changed. We once had a society that had a lot of members in the family. So, even if you did not have a lot of connect outside, you could just come home and you had all kinds of people in the family. So there were 10, 15, 20 people in the family of different kinds, with different views, with different perspectives. And so even if you did not have a lot of friends outside, you could actually, gain a lot of connect within the family itself. We would come down to today, where we stand, where most of us are a part of nuclear families. It's just 2, 3, 4, 5, and not many more. So, and there, all the more the importance of the social connect, I would say, because, we go out of our houses, we spend so much time outside, and as you said, as doctors, most of the time is spent with our patients, and there are so many different kinds of patients. They come from so many different strata. They have so much to offer, and so if you can really develop a good connection with each and every person that you come in contact with, which might not necessarily be at your intellectual level, you might not be able to exactly associate with every person that you see. You might not agree, you might not have an instant bonding with every person that you see, but you can definitely have a connect with every person that you associate with. And if we look at it even from the physical perspective, even if I just leave aside the mental perspective, there have been so many studies which have shown us that people who have a better social connection, they have a better chance to leading a healthier life, which means that lack of a social connection is associated with, detrimental factors like, say, obesity, like smoking, like high blood pressure. And on the other side, a person with a strong social connection has been seen to have a longer chance of, longevity, a stronger immune system, who generally recover from any kind of diseases earlier. And these are actually studies that have been done. So we do know that, you have people to fall back on, and no matter who they are, they could be your friends, your neighbors, or anybody, that helps you cover so many aspects of your life. We all go through ups and downs. On the flip side, and if you have people with whom you can talk, you can share, or maybe just not necessarily share your point of concern, not your reason for anxiety, but just anything else. You could be talking about a book, you could be discussing a film, you could be discussing anything. You could be also have a group which discusses about clothes. And initially, when I had initially joined that social group, I was like, really, am I really joining a social group which is discussing about saris? I don't even wear saris. But when I joined in and I saw the amount of positivity that was generated there, how people just, clapped for others, backed others, spoke positively about others, that really helps you. You would not probably realize the difference that it makes in your life, in you, in the way you're looking at life, how it adds on to your self-esteem, how it helps you to, have greater empathy for others, how it makes you more trusting, it makes you more cooperative, and in turn, people are more open to you, they trust you, they cooperate with you. So all in all, social connect is about a positive feedback. It's about creating a loop, a positive loop of social well-being, of emotional well-being, of physical well-being. So if you were talking about, you had the second part of the question where you actually said that, does it help you actually? So social connect, certainly it helps you, because on one hand, you could be having concrete help, like you have a friend to whom you could go in times of trouble. You could ask for help, for emotional support. Well, like somebody who's ready to be there for you and like, to listen to you when you're having a tough time. Social connect helps you broaden your perspective, that you tend to look at things in a particular, when you talk to 5 other people and you learn that, okay, there's a different perspective to this also, and you learn to widen your view. You also get a lot of advice, which you might choose to take up or not, but at least you learn from a lot of people. And validation, your thought processes get validated, positive things get validated. So all in all, you could have a support system where you're comfortable, where you get help and you give help, where you help solve problems and get your problems solved, make you feel more valued. So before I wind up, I'll just like to tell you about one particular incident which I had seen. This is part of a social connect, a social media group, which was basically about fun and vacation and everything. But there, one particular girl, she was going through a not very good phase of her life, and all of a sudden at around 11:30 or 11:45, she drops a message saying that, I'm feeling very down and I don't think I'm going to live, or something of that sort. She had put in a very negative message. And within a span of 10 minutes, there were hundreds of positive people, who were egging her on and telling her that, no, don't give up. This is just one time of your life. And, by tomorrow you'll be thinking about things differently. And in fact, one person from that particular group who happened to stay, say, around 15-20 minutes away from her, actually landed in her place. And the next day, this girl puts up, another message saying that, I'm so thankful that at that point, I don't know, I could have just done something. And then somehow I felt, I put up this message, and there was so much of positivity from unknown people, from people whom I've never met, I've never seen, but they went out of their way to do this for me. And today, thankfully, I have, I'm back in my senses and I'm back all right. And that is when, you realize the importance of a positive social connect. From people, even with people who you don't see or you don't know personally. But if we can spread this loop of positivity with the social connect, no matter with whom we are connecting, I think we are building a so much better society for ourselves.
Yeah, that's very wonderfully said. The simplest form of a connect is when many times I see your patients who come to Mumbai or are settled in Mumbai and go back in Siliguri and show you also. But I always say, sir, madam se milke bahut acha lagta hai.
Oh.
I mean, I know you are doing a wonderful job, but the connect that they carry with you, and also sort of, it's a moral responsibility for all of us to not only write a prescription, but also heal the patient. But I think one thing that is always labeled is metabolic well-being and psychological well-being, mental well-being. So somebody who, or if we are doing a medical conference, we focus on medicine. If we are doing a conference like this, we focus on mind. What we miss is the body and the lifestyle modification. The first slide, which starts of treatment, ends with LSM, not even a full form. And I think we all are endocrinologists. Everyone sees at least 2 to 3 doctors every day. And looking at their lives also, we feel really laid down. Also, so many of our patients fail to exercise or diet regularly. But we have with us a role model. Dr. Juneja madam is known for being a fitness freak. Nobody can guess her age for today. That's jokes apart. But she also inspires her patients very well for being consistent in physical activity. So it's another very googly, madam, that how does physical activity and regular exercise influence the psychometabolic well-being? So we all talk about mental well-being, we all talk about metabolic well-being, but how does exercise influence the mind and metabolism positively?
Thank you, Ameya, for that very pertinent question in today's times. And thank you, Dr. Vaishali, for inviting us to Synapse and being, it's an honor to be a part of this wonderful, totally different, one of its kind symposium. So coming to your question, the role of how does physical fitness influence psycho-metabolic well-being? I think the first thing what we need to understand is how do we define fitness? Anybody who's thin, so probably people look at me, I'm thin, and they say, doctor, you don't need to exercise, you're fit. So in our minds, the role has been that if somebody is thin, he or she is fit. And the converse also, somebody who's overweight or obese, they are not fit. And so this is where we need to start making in our society the change in the attitudes of a patient, the mindsets of a patient, and the thought processes of a patient. So being thin is not fit. It's being fit is being fit. Period. Bottom line. So what is fitness? So it could be an overweight person who's regularly into exercise, who's conscious of his eating habits, who's mindful. Everything put together, what Dr. Sandeep said was a brilliant concept. So all of them put together is called fitness. It's fitness in terms of the mind, body, and the soul. So when we talk about physical fitness, I'll stick to physical fitness. So we have moved away from the concept of weight-related fitness. So weight, BMI, waist circumference. Yes, we cannot ignore them. We have to keep some point of, a point to say that, well, beyond this, it's not really good for your health to keep your BMI above this target. But at the same time, what we are now looking at is body composition. So when we talk about body composition, we talk about your muscle mass, your lean body mass, and your bone mass, and of course your fat mass. So it's interesting to see that how many thin people have a lot of fat stacked inside their body. So it's not just your weight, it's also your body composition. And when we exercise, obviously there's going to be a change in your cardiovascular endurance, there's going to be change in your body composition, and this reflects in terms of better control of hypertension, diabetes, cholesterol, your fatty liver, your polycystic ovaries. All those medical problems have been shown time and again over the last many decades to have been benefited by exercise and weight and being fit. Now, there are metrics to diagnose to understand this, like we could look at the heart rate. So a person who's exercising regularly, a fit person, their heart rate's under control, their blood pressure is much better controlled, their respiration is better controlled, they're sleeping better in terms of VO2 max, their parameters which measure the fitness of the person. So these are all the physical characteristics, but the mental health part of it has been often relegated to the background. And for some reason, maybe we are too busy to look at in our daily practice schedules or so, the mental health gets neglected to a great extent. And what exercise impacts positively, and well, Ameya also is a fitness person. We know we have a group together, and we know that how reinforcing each other, how motivating each other into exercises has a positive impact. Now, exercises, there are a lot of studies, and believe me, there are levels at scientific level, at scientific studies, at molecular levels, at the neuroendocrine levels, which show that exercise positively impacts the mood, memory, cognition. Whatever we have a response to stress. So basically stress increases their flight and fight responses. So the cortisol axis is activated, and that can increase the blood pressure and the heart rate. But when somebody is into a regular exercise program, it has been shown that the heart rate is better controlled, the respiratory rate is better controlled. So the overall mental health is better, physical health is better, but they are also able to handle, they're able to cope better with stress. They're able to sleep well. Their cognition is better. The problem solving skills improve, especially in patients with anxiety, depression. To talk about the more common varieties of anxiety and depression, which are common in terms of with mental health professionals deal with, when people get into regular exercise regimens, they definitely are more calmer, they are more collected, they're able to understand the problems, and they're able to solve the problems better. They have better social interconnect. How does this work? It's probably the neuroendocrine mechanism. We have the hippocampus, we have the amygdala, we have the limbic systems in our brain, and these talk to each other. They secrete a lot of hormones, and one of the commonest hormones which has been researched about is neuropeptide Y. The neuropeptide Y is the one which helps the body to cope with stress. And in fact, it has been seen that people who go through post-traumatic stress disorders, the neuropeptide Y levels are very low, and when the exercise sets in, it increases the neuropeptide Y levels. So these are the molecular mechanisms and the hormonal mechanisms which help to regulate the mental well-being in patients who exercise regularly. So overall exercises, as I said, it would lead to better sleep, stress relief, improve in mood, cognition. They also feel less tired. Now, other important aspect is weight loss. Of course, we know exercises would lead to better weight loss. And when you talk about these group of patients who suffer from mental health issues, that primarily many conditions cause weight gain, and there are medications which also may promote weight gain. So people who exercise with mental health issues, who exercise regularly, the medication doses could be reduced. Actually, their weight could be brought under better control with lesser drugs. So in a way, it positively impacts overall well-being. Of course, in reduction in the broad parameters like your cholesterol and your cardiac inflammatory markers, improvement in cardiovascular fitness, all of them is seen. Interesting aspect is increased incidence in sex, and that of course is an important part of well-being as such. Dr. Jumani will be taking the stage later on. So overall, exercise impacts positively in terms of a holistic health of the person. So we should be encouraging our patients, maybe probably take a couple of minutes to understand what their exercise regimen is and motivate them to stay focused on their exercise.
And one adjunct to the question I would ask, because whenever you get up, as it is that if you want to exercise, the first challenge is your mind, which also gets up and says that majja.
Very true. Very true.
15 minutes more.
Yes.
And then a good number of people, and many of them who come to us for their health, actually face a challenge that even if they want to exercise, the knee or the breath challenges them to do what has been advised. How to overcome it?
Yeah, I think it's a very pertinent point, because I think these challenges are universal, be it you, me, or anybody. So I think you talked very nicely about two challenges: the actual physical challenges and the logistic challenges, and third is the mental challenges. So I'll talk about the mental challenges, which are both common, because that easy excuse, basically it's training the mind. The mind is essentially lazy. The mind doesn't want to go to exercise. So we need to constantly keep reminding our mind that, let's do something fun for our body, let's do something fun for our mind, and at the same time enjoy the process, and also both physically as well as mentally feel better about it. So it's probably two parts of our mind should be talking to each other. So motivation is an important aspect, and exercise is believe me, it's a cascade effect. So it just becomes a vicious cycle in terms of the goodness of exercise. This point has been a valid issue, especially in the pandemic, because people were isolated. So there were no sources. There were restrictions on outdoor movements. There was the concept of wearing a mask when you're exercising. So the processes of walks and all, I think for 2 years, all of us in the pandemic suffered. But in that also, a lot of them found out ways to beat around. A lot of them started indoor training. A lot of them, honestly, even I got inspired by a fellow endocrinologist, and I've also run indoors. I run 25 kilometers in a small house in Bombay. So that I realized how the mind, for me, it was like, how could you run indoors? And there I was doing this. So it's your mindset. And I think you just need to work on it, and be gentle with it, handle it with tender loving care, and be, cajoling, how we cajole our children. Let's cajole our mind and ourselves also. So one is being in constant sync with the mind. There will be times that despite all this challenge, all this, you will find it extremely demotivating to get up and go for a walk or a run or for yoga and everything. I feel in that circumstances, having a group helps. Now, if you work out in groups, that each of us call each other and chalo, let's come down, let's go for a walk, or let's go for exercise. In the pandemic times, that also has got affected, but man is a survivor. Human being is a survivor, and they have created virtual groups. So Amay and me are part of virtual groups where we constantly encourage each other, like, let's post a thing. And seeing that, believe me, it is a huge mind booster. It's a huge motivator. So lack of and other things which I found personally is like, keeping yourself ready, buying the new equipment. So let's buy a new t-shirt, let's buy a new pair of sneakers. So all these small things will help decluttering the space, keeping a little exercise. Suppose we are into indoor games or into yoga or HIIT, just a little area of a house which needs to be cleaned, and so that anytime you could just put in your mat or just do your exercises. So I feel all these things, small tips which help, and it's been a personal experience, and it's also there in the literature, which help in improving the motivation and adherence to exercise.
Very, very well said, ma'am. It's need of hour that we need to learn how to motivate our patients to exercise. Coming to one of the most important and probably a very neglected aspect, that is sexual health. I would like to know from Dr. Jumani sir that how important and relevant is sexual health, and how does it reflect on mental health? Also, how much is it ignored in mental well-being? Dr. Jumani sir, please.
Oh, thank you, Ameya, for that initial sexy introduction. Well, Ameya, sex is a very long subject where nature and cultures collide. Navigating through the mysteries of sex is one defining question. We are all born sexual and spiritual human beings. And Rishi Vatsyayana in Kama Sutra clearly mentions that sex is to be used and not abused. Sex is not a secret. Who doesn't know what is sex? All of us in the world know what is sex. But why we must realize one thing, that sex is not a secret, but it is sacred. It's the only energy which is giving life. No other energy gives life. And we are all born out of love and sex. And sex is God made. Avoiding it is human made. So we need to have an understanding that this is one of the deepest connect with our own self to the world outside. And when we talk about intimacy, it is ageless. But to ignite intimacy, we need strategies of mind and body for optimum pleasure. I do not discriminate when I see a lesbian or a gay or a transgender or anything like that. Everyone's pleasure is his business and his right. And we know that sexual pleasures occur in the brain and not in the genitalias. We have a lot of patients who come with myths about genitalias, so that needs to be understood. And today we are living in an urbanized civilization with too much of freedom. Our youngsters, our children have so much of freedom, we never had that. And high-speed internet, affluenza, we have McDonald's, we have Domino's, we have KFCs, we have bars today I see bars in every lane of my city. And all these, and plus being in a rat race, these all things do affect our mental health as well as sexual health. Now, one thing I ask, that why are we scared about heights? What is the fault of the height in getting scared? When we look at a snake, we get scared. What is the fault of the snake in we getting scared? So this all things happen because we've got certain belief systems in our mind, which are culturally driven since ages, and that still goes on in our life. So the biggest culprit, which I feel in our taboo, is the belief system which we carried on with. Culture is not bad. Our culture is one of the best cultures across the globe. It has improved, or it has been corrected over the period of years in all the aspects except the understanding of love, sex, and relationships. Now, as a sex therapist at this Sir JJ group of hospitals, I see variety of patients, thousands of patients. They all are having sex-starved lives. Most of them have some physical problems, some mental problems, like, physical problems like diabetes, hypertension, dyslipidemia. They're smokers, alcoholics, they watch a lot of porn, and they get porn-induced sexual dysfunctions. And all these things do have a psychological component with it. None of them are just purely organic or purely psychogenic. And even in women, we see low desire. What is that? It's again a mind. And many a times men come and tell us, Doc, we can perform outside the marriage much better than within the marriage. So this is again a mental issue. So let us understand the science behind all these things. We need to understand as we age, there is definitely going to be low hormones like testosterone and absent and estrogen in women. Prolactin plays, thyroid more or less affects a lot of things. So these all affect the male or the female sexual response, which we all. These are all going to be there. So we need to understand and give our patients realistic expectations. They have all unrealistic expectations. So the counseling part of being realistic with what they are has to be understood and make them learn to accept and adapt to the new situations. I will now show you few slides of mine which will really make some sense into what I said. Are the slides visible? Amir? When we look at any sexual dysfunction, it does affect the individual. He feels inadequate, reduced self-esteem, he feels frustrated, anxious, depressed. He avoids having sex and he tries to find fault with others. And it does affect the partner with being anxious, frustrated, anger, deflated self-esteem, depression, and avoidance. And there is definitely a dent in the relationship, like they are unhappy, impaired communications, violence, marital breakdown, poor. So a beautiful study called a female study. Look at the mnemonic. It's female experience of men's attitudes to life events and sexuality. They studied 293 female partners of men with erectile dysfunction. So what was the result? They said some women felt that they can obtain sexual gratification even without a good erection if they had deep level of non-sexual intimacy. Some women questioned their attractiveness. They felt they were not attractive enough for their partners. Some women felt that partners had infidelity, some lafda somewhere. Some questioned the worth of relationship to be sustained, that this is not worth a relationship, now we should quit. They go in for divorces. Some women felt that sex was something to be avoided. But majority of them agreed that the quality of life was affected as there was frustration, sense of inadequacy, self-blame and insecurity. Important has been the biggest cause of divorces in India, what we have seen. And the real world observational results of several million men in United States said that because erectile dysfunction, diabetes, cardiovascular disease and depression are interrelated, we need to be very conscious and we need to just not treat the erection part of it, but the whole thing has to be studied holistically. And that physician should check for the potential of these respective serious comorbidities even among patients as young as 30 years. My plea to all is that we should ask every patient who's 30 years and above and having a family history of metabolic syndrome, ask one simple question, that do you have problems in making love? If they say yes, trust me friends, and they were in fact waiting for you to ask this question. It is we who have to be proactive and break the silence. How do we treat erectile? I'll just show you one example of a sexual dysfunction which is there. The first line of treatment, though it's oral drugs, we have beautiful drugs like sildenafil, tadalafil, udenafil, vardenafil, and now new kid in the block is avanafil. The second is intracavernous injections, vacuum therapy, intrauterine intraurethral prostaglandins. If all these fail, we send our patients to surgery for implants or anastomotic surgery. But what is most striking here is the best thing, the best treatment which we give to all patients who have sexual dysfunction is counseling and lifestyle measures. These two are the benchmarks of the treatment for any sexual dysfunctions, be it in male or female. The 2018 revision study process of care said lifestyle changes may be accompanied by the first line medical therapies of sexual counseling and therapy. We have 17 years of giving pharmacotherapy, but they are not the cutting edge pharmaceutical solutions. We are living in an era of they need multiple drugs. All PDE5s, though they are effective and safe, but yet they do not prove or they do not cure the whole thing, because we know erectile dysfunction is nothing but endothelium. Unless and until we cure the endothelium, we restore the endothelium, we cannot achieve. It is going to be, he has to take medicines as and when he requires, and patients are not adhering to the medications because of various reasons. They say The reasons are, they say there's time constraint, they feel medications control their sexual life, and they feel that they're nothing but a pill sort of thing. So there are a lot of patients, 40 to 50% patients, who do not respond to the treatment. And the flaccid truth is that though endothelial dysfunction causes erectile dysfunction, this causes emotional dysfunction, and these are all manifestations of aging and age related complications, which include diabetes. And we know India is almost the diabetes capital of the world, and erectile dysfunction or sexual dysfunctions, both in male and female, do happen in diabetes. But what is more important to understand today, direct studies says that there is a remission of type 2 diabetes. Type 2 diabetes is reversible. It is not a myth but a reality. My friend Dr. Paresh Dandona from Boston, he gave patients testosterone who had diabetic and had hypogonadism. In 2 years of testosterone therapy, he found that everything was becoming normal. Insulin resistance improved, functional hypogonadism also improved. Dean Ornish, long time back, proved clearly that with intensive lifestyle changes, you can reverse the coronary artery disease. Cleveland Clinic clearly mentions that nutritional intervention not only halts but even reverses the coronary artery. Look at this huge plaque, which was completely opened up just by nutrition, not with statins or any other therapies or any surgical interventions, etc. So the doctor of the future will no longer treat human frame with drugs, but rather will cure and prevent disease with nutrition. Thomas Edison said this hundreds years back. And 2 times Nobel Prize winner Dr. Linus Pauling clearly said, nearly all diseases can be traced to a nutritional even if it is a mental disease, even if it is a sexual dysfunctions. So we have 4 PDE5 inhibitors. They do not increase the desire. They do not work on the mind. They just work on the increasing the blood flow in the pelvic regions. And 40% are non-responders. So what do we do for them, for these patients who got erectile dysfunctions? We give them testosterone. It is given in and out. Even the gym instructors are giving testosterone, but we need to give it with caution. We can't give it to younger patients because they may get azoospermia. We can't give it to elder patients. They may get heart failures or prostatic. So what is the way out? So the Raja of all is amino acids like L-arginine, fenugreek, lifestyle modification, and regenerative. This is what is going to be. Can endothelial dysfunction be restored? Yes, it can be with following medicines like statins, ACE inhibitors, antioxidants, estrogen. My teacher, Dr. R.D. Lele, showed successful strategy for reversal of endothelial dysfunctions long time back. So we have got this mechanism in place where we can reverse the endothelial dysfunction, and lifestyle and dietary modifications will not only improve the pro-inflammatory milieu, which we are all in, it will improve the insulin resistance, it will improve the endothelial dysfunction, also reduce the oxidative stress, and give a feeling of improved well-being and reduce the burden of sexual dysfunctions. So make lifestyle modification as a religion, not just as a medicine. So my take-home message is, whatever be the causes of sexual dysfunctions, everything can be cured or managed today. It is a shame for a man to grow old without seeing the beauty and strength of which body is capable of. Socrates beautifully said. So motivate your patients to challenge yourself to do exercise, do yoga, do positive thinking. Very important. The secret of sexual fitness is love yourself. Avoid salt, oil, and sugars. Don't go by the extensive, dietary things. 8 baje ye khao, 9 baje wo khao. Nobody can adhere to any diet. All diets are good, but give them a blanket permit not to have excess of salt, oil, and sugars. Give a U-turn to your metabolic imbalance. Have a regular rhythm of sex life, and romance and touch. Vitamin T and vitamin R really gives you a supreme feeling of satiety mentally also. Sexual dysfunctions are not an option at any age. It is how gracefully we handle and the process, and how lucky we are as the process. Touch is absent. My patients, they hardly touch each other. They say, what will my daughter think if I'm hugging my wife in front of her? She's 22 years. I told them what she will think. She will only think that you love each other even at this age, and this is what the signal you should give to your children. They don't hug each other. They don't even say I love you to each other after they 40 years of marriage, nothing. You have to increase your romance. There is no GST on romance. Please increase the romance is amazing. And all women want romance and communication. This is the secret which they should understand. And sex at a certain age is not for procreation. It is for increasing the bond, the connect. You are partners for life. Love each other unconditionally. And I must say that men have sexual issues more than women, and they don't take treatment. They avoid having sex. They deprive their partners of whatever pleasures which is a right. So feminism needs to be adored, admired, trusted, and respected. We have learned from Ramayana and Mahabharata what is this. So feminism needs all men who have issues should talk about it, should take treatment, and have a good quality of life. Last slide. Sexual education is very important. Educating children, educating adolescents does not mean you are giving them permission to have sex. You are giving them a choice as to what is right and what is wrong. So we need to do a lot of research in finding out what are the educational models, which will impact. So we need to explore all the reasons possible and to initiate or motivate them to change their behaviors. My last slide. Sexual health, synapse, mental health. That's the connect. That's the neuron. Are both have a bidirectional connect. Male sexual dysfunctions and female sexual dysfunctions are common and undertreated. Every organic cause of a sexual dysfunction has a psychological component. Fear, anxiety, guilt all lead to avoidant behavior. Erectile dysfunction is very, very common. Every diabetic has it. And it's one of the commonest and the earliest complications of diabetes. Counseling and lifestyle modification can reverse metabolic syndrome and also coronary artery disease. Age, weight, height are just numbers. A heart that loves is always, always young. Friends, if all this is there, trust me, erectile dysfunction, according to me, is a erectile dysfunction. And if so, sexual well-being mandates well-being, mental well-being, and mental well-being mandates sexual well-being. It is both ways true. And if all this happens, trust me, sex really has no expiry date. Thank you very much for your love. I'll be happy to answer any questions you have.
Thank you, Dr. Jumani sir. I also extend my heartfelt gratitude and thanks to all the panelists, Dr. Deep Datta, Dr. Sandeep Ruder, Dr. Arundhati, Dr. Archana Juneja Madam, Dr. Deepak Jumani sir, and also team Synapse, Dr. Vaishalideshmukh Madam, and the entire organizing committee, Dr. Phadke sir, for giving us this wonderful opportunity to be here in Pune, at least virtually. If there are any comments or remarks, please feel free to express. Thank you each one and all, and thank you to the AV team also. Thank you.
Thank you, Dr. Ame, and thank you all for this nice session. So